You'll have met your anaesthetist on the morning of your operation in the ward before you come to theatres. You and the anaesthetist will have had a chance to discuss what type of anaesthetic would be best for you, and that's likely to either be a general anaesthetic where you go off to sleep, or a spinal anaesthetic where you have an injection into your lower back to numb the nerves in that area so that you'll be completely pain-free during the surgery. For different patients, one method is more suitable than another, but that will be discussed by you and the anaesthetist before you come to theatre. When you arrive into theatres, you'll come to the anaesthetic room, which is the room we're currently in, where the anaesthetic will be conducted. In the terms of a general anaesthetic, you will be lying flat on the operating table. Some monitoring will be attached to keep an eye on your heart rate and blood pressure and so on. And a small needle will be inserted usually to the back of your hand to administer the anaesthetic drugs to you. If you're having a spinal anaesthetic, then you will be sat up, some monitoring attached to you, and then the anaesthetist will perform the spinal anaesthetic into the lower back, as we discussed. With some of the cases, we also administer a nerve block to the patient, which involves having a local anaesthetic injection in around some of the nerves supplying the area that's to be operated on. Once we're happy that the anaesthetic is established and completely sorted, you'll then be taken through to the operating theatre, where the anaesthetic team, which is made up of the anaesthetist and the operating department practitioner, will look after you for the duration of your surgery and administer other drugs as required. For many of the patients having a spinal anaesthetic, they will also have some sedation given to them so that they can snooze during the procedure. If you are having sedation, you will, however, still remain aware of your surroundings and may hear people talking in theatre and some of the rather noisy equipment that they use as well. But none of this should be uncomfortable or painful for you. Once the surgery is completed, you're then taken to the recovery room where you begin your recovery phase of your journey. The whole time you're with the anaesthetist, there is a plan to focus on making you comfortable, both during the operation, of course, but also thinking of that early post-operative period so that we can get you awake, comfortable, and able to start mobilising and preparing yourself for the getting home as early as practically possible.